Ryan, thank you. Getting adolescents vaccinated seen as a big milestone in the fight against COVID-19. 12 to 15-year-olds, that'd be 17 million Americans who would likely soon be eligible for the shot.
So we know parents have a lot of questions about getting their kids vaccinated. And so this morning we're going in depth with Dr. Matt Anderson, Senior Medical Director of Primary Care at UW Health. And Dr. Anderson, as always, thanks so much for your time this morning.
Yeah, we're glad to be here.
I'd like to start with this. I'd like your expertise. We're seeing school districts in the area shift to COVID protocols. Quarantining, some districts have dropped the quarantining requirements, and now we're seeing families asking that mask mandates be dropped. In your medical opinion, how smart would it be to drop a mask mandate?
You know, masking really is about source control and preventing transmission. And so especially in unvaccinated populations, you're going to be in a higher risk situation with that. We know that kids are lower risk, but also do have the ability to transmit, and particularly to potentially other vulnerable individuals around them. So I think that we look at that. Hopefully we can get more people vaccinated with the updates from ACIP coming this afternoon, and that'll keep us moving forward in the safest way possible.
Talking with Dr. Matt Anderson of UW Health. Dr. Anderson, you mentioned the vaccine and the decision expected today. You know, one thing with vaccine hesitancy that may give parents pause is if the vaccine is safe for kids now, why wasn't it safe 4 or 5 months ago when the Pfizer vaccine was first rolled out? Can you explain the process of this approval a little bit?
Yeah, I think it really underscores that safety is the #1 priority. So the original clinical trials, because of the higher risk individuals, were in the older age populations. Pediatricians will tell you that kids are not little adults. And so we need to make sure we have the right dose and how does that body respond physiologically. So it really was about making sure that it was safe. And so all of that extra work was about verifying, not assuming.
Mm-hmm.
And so at this point, Dr. Anderson, it seems as if most people are expecting that this vaccine will be approved for 12 to 15-year-olds. If there's a parent at home watching you today, what would you tell them if they were hesitant about getting their preteen or teenager vaccinated?
Yeah, I think that, you know, again, safety being the #1 priority, we have a lot of experience with these vaccines and gone that extra step to make sure that we have safety data in this age group. So I have a child in this age group, and I would give them my assurance that I fully intend to have my child vaccinated. I think it's a great way for me to protect them, but also to contribute towards protecting others around us in the community.
That's interesting. Glad you brought that up, Dr. Anderson, because, you know, what medications or substances we put in our body is a matter of really important personal choice. One thing I keep hearing, with the vaccine so widely available, if I'm vaccinated, what difference is it to me whether my neighbor is vaccinated or my kids' friends are vaccinated? Why the continued push to get a large number of people vaccinated?
You know, and we know that, for example, you could still get infected with COVID-19. You still have quarantine requirements and other things. You're less likely, much less likely to be sick, to go to the hospital and such, but there is protection for you. Also, the more coronavirus that we have circulating, the more risk we have for variants, and more variants that we have. If one of those was to have an advantage against our vaccines, it could set us all back. So the less coronavirus we have circulating in our community, the safer we're all going to be over the long haul, the quicker we get back to normal.
Dr. Matt Anderson, doctor, thanks so much for your time this morning. Really appreciate it.
Yeah, thank you.
To find a vaccination clinic near you, all you have to do is head to tmj4.com/coronavirus.